are we heading to a place where you might ask for people's phone data because you've got that power to do it?
Yeah, I think so. Firstly, point of clarification. So some of these exposure sites don't relate to the index case. So people who are visiting the golf shop or some of those other cafes and restaurants relate to these latest cases and not to the case who travelled on the 30th of September. In relation to validating some of the information we get, of course we rely on people to tell the truth, and we really emphasise how critical that is. And it's not to emphasise that you can catch people out, but the reality is if there's another cluster that emerges and someone says, oh yes, I saw X, Y and Z, you'll be found out. There is no reason not to tell absolutely every truthful element about where you've been, whether or not you've been working on particular days and where, and all of your close contacts. Because if those individuals become cases, they're at risk, their families are at risk, their workmates are at risk, and anyone else they come in contact with are at risk. So I really want to emphasise that just being honest with us and giving the full and frank account of all of those elements are really important. In terms of protecting regional Victoria, I spoke to a number of MPs yesterday across Victoria. I am in no doubt about their fierce defence of the kind of COVID-free status of regional Victoria. They want to get there and keep it that way. They represent their constituents with a fierce determination to make sure that this virus stays out of regional Victoria. And so I have no doubt that the people of Shepparton will step up in full and will get on top of this, because everyone will come forward to do the testing that we're asking of them, and that they'll quarantine, and that their families will quarantine at the same time if they've gone to those close contact sites. In terms of getting all of that information, if there's any doubt about the full account that people are giving, there are powers in the Public Health and Wellbeing Act for me to request information, demand information for the purpose of assessing a public health risk, and I'll absolutely consider that in circumstances where that might not be forthcoming.
Humans are fallible. They might not always be honest about their things, not because they want to lie, but maybe because their circumstances don't allow them to. So instead of assuming everyone is being honest with their account, why not assume that everyone is not being honest with their account and try and get the evidence to back up their claims?
I think we are. I think we're assuming that some people will give a full and frank account of where they've been and when, and others will not, for a number of reasons. And again, I recognise that there are issues that sometimes relate to a person willfully hiding stuff, and others who are genuinely fearful of consequences. With respect to visa status, a lot of people have fears about what it might mean for their work. They should all be reassured that no employer has a right to sack you, to stop giving you hours because you become infected with coronavirus and subsequently recover. You have all of the normal entitlements of work that you have now. So yes, we will work on the basis that we need to continue to go back to people to try and clarify information, that we need to engage with them as constructively and as supportively as possible to get that information, and that there will be circumstances where we need to double check it. And if we've got that suspicion that information is being hidden and there's another mechanism to validate that, I'll absolutely use those powers.
But contact tracers are human as well, they might be amazing, they might be able to read people's emotions and thoughts, but we know with this Melbourne case who travelled to Kilmore and then to Shepparton, there was no suspicion that this person wasn't being completely honest. So why not start from the premise of just double checking evidence and just, going back to them to clarify and getting them to, phone logs, or whether it's like truck logs or whatever it is, just starting from that basis as opposed to relying on suspicion.
Yeah, we will have to consider that. I think we'll have to use every tool at our disposal. We don't want people to withhold information because they're in fear that we'll investigate other data that they don't want looked at. So there is a balancing act there as well. But if we have to interrogate phones for GPS information, those powers are available, and we'll consider them.
The balancing act is so many people in Shepparton, even in Kilmore, there's hundreds of people in isolation. Potentially the same thing is going to happen in Shepparton. So the balancing act, it's not comparable to say, I need your data to make sure that you're telling me the truth, versus we might potentially have hundreds of thousands of people in quarantine.
No, I understand that, and the consequences in Shepparton haven't played out, but we know that there are hundreds of people who are requiring testing, who'll be anxious about their risk, and who may end up being positive. We have to balance the willingness of people to declare anything about whether they have a phone, whether they took the phone with them, whether they'll be prepared to hand it over, or we need to go to court. So there are elements about establishing rapport and trust that need to be the starting point with everyone. But yes, we will use whatever tools are available if there's a need to interrogate further some of that data.
Can we just clarify, once you had those positive results in Shepparton yesterday, how did they then get linked back to this person?
Oh, because we ask every case who they've been in contact with. They've obviously referenced a visitor from Melbourne, and we've cross-checked that.
Can I just clarify the situation in Shepparton? Is it the same as Kilmore? In Kilmore, you've said if you've been to this cafe, isolate, get tested, but also close contacts, also people who share their house. It's not clear to me that that is also the approach in Shepparton?
Yes, for those high-risk sites, we're asking everyone symptomatic or asymptomatic to get tested and to isolate for that 14-day period.
And is that going to be the approach from now on, no matter where you might find an outbreak?
We will always look at the circumstances of particular places, but yes, that is the policy. That's the contact tracing procedure for all of these settings.
It went in the city as well?
Yes.
So if Chadstone happened today, would you be doing asymptomatic testing there?
Well, so we did asymptomatic testing for all of the staff because they're considered more akin to a close contact, even though staff worked miles away from those places that were exposure sites. For the vast space of Chadstone, you're actually not talking about even casual contacts, people who were miles away from the Butchers Club or other exposure sites. It was symptomatic testing because they weren't even casual contacts. So that's a different situation. But when we're talking about these exposure sites that we've listed here, there is that requirement to isolate as a close contact, and we're asking everyone to get tested.
And are you confident you have this person's full timeline now?
We'll look into that today, no question.
Is it established with people at the start of the interview with contact tracers that they won't be fined if they tell the truth?
I can't speak to the exact wording in the questionnaire. I think all of our contact tracers are absolutely aware of the need to engage constructively and to give people reassurance about a whole number of things, but I would have to go to the exact wording and the contact tracing team about exactly what procedure they go through to establish that frank and open discussion.
Was it a mistake not to ask or not to get more information from the cleaner in Frankston? I'm told she didn't tell you she worked at the butcher shop. Was it just looking backwards and with the trying to improve going forwards? Was it a mistake not to check more about her location data?
So again, if there's not open disclosure about where people have worked when they've been infectious, it's a really difficult exercise. We go back to people several times. I'm really reinforcing the need to be honest. There's no punishment for being honest. There's no punishment for being completely open about all of that information that we need. But it's a challenge, and it's not about single individuals. It's a genuine challenge across the board. We've had it for months in this phase of the outbreak, but we will review, as we always do, if there are other ways to get information that we think is not forthcoming.
Can contact tracers submit? Okay. Can contact tracers submit licence plates to police to track where they've been?
So again, in the Public Health and Wellbeing Act, it's not about contact tracers necessarily. They're authorised officers under my powers, but I can share information with relevant agencies, again, for the purpose of determining public health risk.
If you had used the contacts of contacts quarantine approach in the instance with the truck driver, would the truck driver have been quarantined by the 30th?
Yes, but the question that Raf asked, I don't know what the Butchers Club specifically said to employees at that time, and it may well be that families were asked to quarantine at exactly that time as well. In defence of the Butchers Club, all the right things done: cleaning, shutting down, telling all staff to quarantine. So workplaces can do the right thing, but everyone who are family members of workers need to do the right thing as well.
Have you checked with this person's employer where they might have been, and do you have the power to request that information?
Yeah, I can request almost anything for the purpose of determining public health risk. But this will be a power of work today, really, investigating all details.
Have those powers to request changed since earlier in the year? Because I know with Cedar Meats you cited privacy reasons in saying that you couldn't ring up the employer and ask, was person X at work on this day? Is that something you can now do that you couldn't previously?
No, they're always available powers for the assessment of a public health risk. In the Cedar Meats case, we were talking about a person who hadn't been at work, literally.
But you said at the time that you'd never checked that with the employers for privacy reasons.
That's right, but the fact was that person hadn't been at work. There was nothing to investigate.
Sorry, can I pick up on a point that the Premier had earlier made about referring this case to police?
Well, it gets referred to Mayor too.
Brett.
The Premier said yesterday maybe 5's the new 0 and 10's the new 5. Are you open to new higher thresholds?
Oh, we have to remain flexible and open to the reality that we find ourselves in. That's what our daily review of epidemiology entails. Where are we? Where are we headed? What are the barriers? Can we get there? We'll have to look at that trajectory in coming days. I think it's, as James pointed out, today's a good day. 4 cases and 16,000 tests is a terrific rate, and I'm still confident that the challenge that we're in right now is about complex community outbreaks, but aged care is we're getting on top of that completely, and this is a shorter term challenge. We've still got mystery cases coming up, about 1 a day. That's a concern. That's chains of transmission that haven't been identified. So those high testing rates are really critical, and we'll follow all of that. But if we have to get to a point about making judgments on exactly where we're at and what next steps we need to make, we'll do that.
And the Premier also said yesterday that it's a higher risk, which you've both said a few times. But what does that mean? If you've got a higher threshold, higher risk, what does that mean for all of us?
Well, it's the risk of a really significant increase in numbers in coming weeks, and this is what is part of that balancing act, that awful balancing act that we've come to. Yes, people have had diminished access to cancer screening services. They shouldn't at the moment. We're telling people to access care, access cancer and other screening services because we're at a point where people can do that with absolute confidence, and it's really important. But you can imagine what it would look like if we have 10,000 cases a day and people are genuinely in fear, and those services are genuinely in fear of having that close contact with clients, with patients. So the decisions we make now are also about weighing up that risk of what a third wave would look like and the probability of it occurring. And so yes, if you ease at a point where mystery cases are still at a higher rate, if daily averages are still at a higher rate, that risk is increased.
And sorry, just one more, Rachel. Does the truck driver qualify as a super spreader? Is there enough cases?
Oh, look, I think there's always that combination with a super spreading event, the infectiousness of the individual and the setting that allows a significant number of people to be infected. We're still at a point in Victoria, and this is what we're trying to control here, that we don't have a gathering of 50 or 100 people in close proximity. But yes, a cafe where dozens and dozens of people move in over time and someone's sitting there for a number of hours is that kind of combination between a clearly infectious individual and a number of people coming in contact. But I guess, we've still got limited settings in regional Victoria for a reason. There are, 10 people in a space, up to 2 spaces for a reason. Because if you've got a very infectious people going into a close quarters with 100, it could have been 100 immediate contacts who were positive instead of the few that we've got.
There's been a case linked to Bairnsdale that the Education Minister confirmed this morning, I think, was in a teacher at Bairnsdale Secondary College who hasn't attended the campus. But where does that case fit in? Is it in tomorrow's figures? How does it work?
I thought it had already been counted in yesterday's figures, but it was acquired in Melbourne. So the individual had their entire acquisition period, the 2 weeks before they became symptomatic in Melbourne.
And just on today's 5 deaths, how many of those occurred in the past 24 to 48 hours?
I can't tell you.
Did any of them, given that we've had no one in intensive care in recent days?
4 were prior to yesterday. There.
Do you know how long prior to yesterday?
Oh, it'll only be a couple of days. Like, we're getting regular reporting on these deaths, but some deaths are occurring after a very prolonged significant illness, especially in the elderly. So, still a number related to aged care. And even though, aged care outbreaks, the number that are active are very limited now, and the number of active cases within those aged care outbreaks is smaller and smaller every day, there are still people who've had significant illness who are at risk of dying and are dying, unfortunately.
So you're confident that that reporting process has sped up? Because I know we had that day where we had 50-odd cases reported, 50-odd deaths reported in the one day, and some of them had occurred, a month prior to
yeah, that
day.
was a reconciliation about reporting that hadn't come through from facilities, but we've got a much more routine, almost daily process now.
With this truck driver at Shepparton, did they explain why he didn't tell you about going to Shepparton?
I haven't got that information. I don't know that that we've got that yet, but he'll be re-interviewed, and of course we'll look to that, and we'll want to know if there's any other locations that we need to investigate.
So he hasn't been re-interviewed yet?
He may well have been, probably as we're speaking.
And in terms of linking him to the Shepparton cases, was it the case that people at the tyre business tested positive and you were then able to establish that he'd visited there?
That's right. So those cases that have popped up in Shepparton obviously speak to the close contacts they've had, the people who've come into that business.
Just on the Bairnsdale case, you go, Rent.
I was going to say, can you categorically say he hasn't been anywhere else, or is that still to be seen?
The understanding we have is that the entire acquisition period's been in Melbourne. I think we're very confident that they haven't been in regional Victoria for any of that period of time.
Sorry, I meant the driver. Can you categorically say the truck driver hasn't been anywhere else other than what we know?
I think that's that's part of the power of work for today.
So just confirming with the Bairnsdale case, were they infectious while they were in Bairnsdale, and is that why the school wasn't closed?
They haven't been on the school site at any time, so not an issue.
Just for complete accuracy, sorry, Steph. Can we call it a super spreading event in our reporting?
We haven't used the term super spreading event. There's no scientific or technical language that really encapsulates that, but it really is a large number of people with that unlucky mix of someone who's very infectious. 70% of people won't infect anyone else. 30% will infect a really significant number. This is how it progresses in these very big clusters at times, and so limiting those opportunities by having smaller gatherings indoors in particular is a really critical control measure. That's what the restrictions have been about all the way along.
And when we were getting into Melbourne's winter, you were worried about the cooler weather and how the virus can stay airborne in cooler weather. Are you what's it going to look like over summer?
I think the key point about summer is that the plan is that we're driving numbers down very, very, very low. And the other thing that we'll look at is maximising, hopefully, it's predicted to be a bit wetter than we might like, but hopefully warmer weather that means outdoor settings can be the predominant setting for a lot of activity for households, for businesses, to the extent that it's feasible.
Just on masks, sorry, Professor, there's been sort of more anecdotal reports of people wearing them incorrectly. Can you maybe explain to us how that can affect transmission? And also, do the anecdotal reports, I guess, show that there is perhaps some lockdown fatigue, particularly when it comes to wearing masks?
I think people will be fed up with wearing masks. I've seen them worn on chins. I've seen a lot that are sitting below the nose. They shouldn't. That's the issue. You can inhale this virus through the mouth or the nose. And, you know, I'm sure that the people of Shepparton will be asking themselves questions, was I wearing my mask properly right through the time that I was at any one of these several exposure sites, because it is protective, and wearing it tightly on the nose and mouth together, if both the source case and the person potentially exposed are both wearing masks properly, you really do decrease the risk of transmission by at least 50%. So I think that's really encouraging. It's a reminder why masks are important, and the infectious period of this virus is for the 1 or 2 days before you've developed symptoms, and then in particular as you're developing symptoms for a few days afterwards. So that's why masks come into their own. It's when someone is out and about, maybe before they've developed symptoms, quite infectious and putting others at risk. So wearing a mask protects you.
Sorry to labour the question, but with the Kilmore truck driver, when they admitted that they visited Kilmore, was there any sort of outside work done outside the contact interview to verify where they'd been, or was it just the interview that was used?
It was just the interview that was used. Yeah.
Was the COVID Safe app involved in it? Had that person downloaded?
I don't know for that particular case. We're asking that for every individual. All right. Thank you.
Thank you.
Thank you.
Thank you. See you tomorrow.